Good day, everyone. My name is Dr. David Amron. I'm the host of Lippy Logic at the Lippy Lounge. And today we have another very special guest that I want to introduce. I'm excited to introduce. Her name is Courtney Jolin. And today's topic is a very big topic, one word, anesthesia. And we're going to try to understand anesthesia for lipedema, how I do it, and the importance of the way in which I do it, quite honestly. First, I have something I've got to give her. This is for every guest of Lippy Logic. Yeah, thank you for coming, really.
Of course.
So great to have you here.
Happy to be here.
Yeah, she's the best. So anyway, Courtney is a certified registered nurse anesthetist. She has come from an extensive background at UCLA, where she did a lot of complicated patients, a lot of plastic surgery also, and has joined us essentially full-time as the main person that we utilize at the Roxbury Institute, myself and the other surgeons. And she is really fantastic. So I'm just going to ask in a general way, what does it mean to you to care for these patients?
I really enjoy caring for these patients. I think the surgeries that you do on these patients changes their lives, and I'm able to see that because these patients come back for multiple surgeries and they're able to speak to me about their experience and how they're progressing with their recovery and just how you've changed their lives, especially calves and ankles. You know, at the end of surgery when you let the patients see their calves and ankles, and it's a very touching moment, I think, for everybody in the operating room to really see the expression on their face and their emotions of how excited they are for this recovery.
A lot of times when calves and ankles are done, we will ask the patient, do they want to see their calves and ankles? And Courtney will raise the back of the bed because they're conscious, and the patient will many times will look and it's just great. I mean, they're just amazed at things. They've said so many different things.
Such as, I haven't seen my calves or ankles since I was 12 years old, or I'm going to be able to fit into my boots. I haven't fit into boots for years. They talk about how their whole wardrobe is going to change. They're going to be able to wear skinny jeans. Calves and ankles are definitely my favorite surgery to watch you do.
Yeah, let's talk about the types of anesthesia that are used for lipedema. And there are really three types. I break it down into this way of looking at things. Number one is the use of purely local anesthesia with just the fluid to do this, which commonly has lidocaine in it. This is really where it's just being done purely under local anesthesia, without any anesthetist or general anesthesia. That's one way of doing it. And I do this in about 30% of patients with just mild sedation. The second way of doing this is local anesthesia plus Twilight anesthesia. Another terminology in the medical community is monitored anesthesia care. And that is what we're doing on the majority of patients at the Roxbury Institute, where I do this with Courtney under Twilight and local anesthesia. And the final way of doing this is under general anesthesia, where a patient is completely out and intubated, but there's a lot of disadvantages, and we'll talk about this. I use general anesthesia in about 1% of patients or less. The advantages of avoiding general anesthesia fall into three categories. Number one is that it is a safer way of approaching it. General anesthesia is fine. It has its inherent risks to it. There's a study done many years ago looking at liposuction in 500,000 patients under general anesthesia, and it showed a 1 in 5,000 mortality rate. And that was for a number of reasons, from increased risk of clot formation with it under general anesthesia called a DVT, causing a pulmonary embolus. And the second cause was perforation of an organ by the surgeon who's getting out of that safe plane. So it's definitely a safer way of approaching it. The recovery is faster under avoiding general anesthesia, typically because the surgeon has hydrodissected the area, creating that bloodless field that I so much talk about in the proper preparation of the tissue. And so that is an important advantage, that you have faster recovery, you have less bleeding, less bruising. And the final important thing, which we've talked about in many different segments, is about results. The ability to position patients perfectly throughout the entire procedure so you can always stay in that safe plane, avoid traumatizing the muscle, and not disrespecting the skin.
I have worked in plastic surgery for about 5 years, and I've been at the Roxbury Institute for a few years, so I've definitely seen a lot of liposuction. I've seen a lot of liposuction under general anesthesia, and then coming to the Roxbury Institute, it was definitely interesting for me. It was a transition to be able to do liposuction under conscious sedation, and you know, I've been able to see the benefits over the years with the patients. You're able to get them into all of these different positions. He will have patients point their toes, flex their toes, you know, they're on their side. So he's really able to see that muscle definition and get the incredible results that he's able to get.
Let's talk about this aspect of how patients feel about it. So once patients hear they're awake and conscious, you know, it's common to be anxious about it. They may understand my whole process and even, you know, feel that it is superior for all these reasons. But when it comes down to it and it's time for surgery, you know, they do get nervous about it. And I tell patients, you know, it's normal to get nervous. And most patients afterwards tell us the same thing over and over again, that it really was so much better than they thought it was going to be. Courtney is great at knowing the level the patient needs to be in all the time. We start initially by taking them down a little bit deeper while I'm putting the fluid in with this instrument here and letting it slowly seep into the fat. And then after that, the areas are numbed. They're tumesced completely, so patients feel virtually nothing, and then Courtney will lighten the patient up so they can assume very exacting positions.
It's not common at all that they feel a lot of pain. I think the initial part where you're numbing all of the areas, and I am able to bring the patient down to a deeper level of anesthesia. I give the pain meds more up front so that, you know, they're not experiencing a lot of pain during that portion. And then after everything is numb, I've even been amazed at how little pain patients have had. I've had patients compare it to a deep tissue massage. Once everything's really numb, they really just feel pressure in certain areas from the fluid being underneath of the skin.
In my experience, because I've done this for over 27 years in about 12,000 or more patients total, and between 4,000 and 5,000 lipedema patients, that I would not continue doing it this way if I didn't believe in it, and if it was not almost always an extremely tolerable way of doing it. Courtney has been with me for years now, and we've done hundreds of patients, and I'm just going to ask her this. Have you had a patient in the time that we've done this say that was excruciating, the pain was really that bad with it?
No. Yeah. Maybe 1 or 2 max, but all of the patients are very surprised by how little pain that they've had.
So that's that on anesthesia, a big topic. Hopefully that answers a lot of your questions and clarifies the difference between all these different types of anesthesia, the advantages of avoiding general anesthesia in the way in which I go about doing this. I will say that Courtney is also the best. I've worked with dozens of people over the many years, and she is just amazing. Not only just is she a great anesthetist in terms of what she does from a safety standpoint with patients, she has a lovely, lovely demeanor about her with patients and just makes them feel so great about things. I'm proud to have her part of the team at Roxbury Institute, and if I ever needed a procedure done, I'm going to go to her. So anyway, thank you so much for, yeah, absolutely, absolutely. So I'm Dr. David Amron. This is Lippy Logic at the Lippy Lounge. Thank you for tuning in.